Hello and a very warm welcome once again. I am Mugdha Kalra, your host for the ongoing unique podcast series Rainbows of Hope, brought to you by Rainbow Children's Hospital, India's largest group of hospitals for pediatrics in association with Earshot. In this unique series, we talk about pediatric diseases and disorders and how doctors relentlessly work to get our children back to good health, laughter, and cheer. Lives of parents and near and dear ones revolve around the world of children, and it is really hard to see them endure hardships when their health gets compromised. But that's where we find rainbows of hope. In the first episode of Rainbows of Hope, we had discussed autism with Dr. Lokesh Lingappa from Rainbow Children's Hospital, Banjara Hills, Hyderabad. Now in the second episode, we have Dr. Nandini Hazarika with us. She is a senior pediatric hemato-oncologist at Madhukar Rainbow Children's Hospital, Delhi. After completing her MD in pediatrics from Assam Medical College, Dr. Nandini did her fellowship training in pediatric oncology from Kidwai Memorial Institute of Oncology, Bangalore, and subsequently completed 3 years of residency in pediatric oncology in Dr. B. Barua Cancer Institute, a unit of Tata Memorial Hospital, Mumbai. In her long and distinguished career, she has treated all kinds of hematological and solid cancers in children. Welcome, Dr. Nandini.
Hello, Mukta.
In this episode, we will be discussing blood disorders and cancers in children and the treatment. India is home to at least 20% of the global childhood cancer burden. And according to the World Health Organization, nearly 75,000 kids are getting cancer every year. So let us begin.
So when we talk of pediatric blood disorders, most commonly we see like nutritional or iron deficiency anemias, which are very common in our country. And then there are some complicated problems like thalassemias or sickle cell anemia. So these are some inherited blood disorders, which where like the child inherit the gene, the abnormal gene from parents. So these are some difficult situations like when the child has thalassemia or sickle cell anemias. Then some other major problem of blood is like aplastic anemia, where the blood cells are not formed. Like our blood cells are formed inside the bone. There is a space called bone marrow where our normal blood cells are formed. So in aplastic anemia, the blood cells are not formed inside the bone marrow. So these are some of the major issues. Then there is very common condition called ITP, immune thrombocytopenic purpura, which we see very commonly in children after a viral infections, where the platelets, this is another blood cells, which helps us to prevent the bleeding inside our body. So the platelet is reduced in this patient with ITP. So most of these patients, like for thalassemia, they will present as anemia because the anemia means hemoglobin is low. And in sickle cell also they can present with pain because this RBCs, the shape is different inside the blood vessels. So they will have clotting kind of things inside the vessels and that causes a lot of pain. So then ITP can present as some red spots in the body, like rashes or some bruises in the body. Then coming to other blood disorders, like if we can call cancerous blood disorders, these are non-cancer blood disorders, which I have already spoken about it.
Right.
The other is like blood cancer, which is the commonest cancer in children, especially between 2 to 10 years of age. And they usually present can have fever for a long duration of period. If fever is not controlled or we are not able to find any cause for fever, child is having fever for 2 to 3 weeks, that can be a possibility of blood cancer. But along with that, child will have low hemoglobin, child will look pale, there will be red spots or black spots, as I said, because platelet will be low. There will be bone pain, joint pains. So there can be lymph nodes, enlarged lymph nodes in the neck. So this can be associated features of blood cancers. Then there can be other cancers, common cancers like brain tumors, then lymphomas where lymph nodes are enlarged, then some abdominal tumors like neuroblastoma, we call it, then kidney tumors, we call it Wilms tumor. Then very small children below 2 to 3 years, they get hepatoblastomas. It's a liver tumor. Then the cancer can also involve the eyes, which is called retinoblastoma. Then we can also have bone tumors. And then tumors can also involve the muscles and the soft tissues, which are called sarcomas. So different type of cancer can occur in children, and any of the organs can get involved.
Dr. Nandini, it's truly heartbreaking to even imagine that there are so many of these blood disorders that can attack our children. How life threatening are these conditions?
Yeah, most of them can be life threatening if they are not treated, like especially the cancers. If they're not treated, yes, they can be life threatening. And even especially iron deficiency anemia, I can't say life threatening, but it looks very simple, but it's a big problem in our country. Even I see very educated parents coming to us, well, financially well established people also, their children are having nutritional anemia, especially iron deficiency. So that means there's maybe some problem with the awareness or the food we are giving. It's more of a milk based food we provide, no, that causes difficult. Iron cannot get absorbed with the milk. So that is a major issue, and iron deficiency can lead to cognitive dysfunction in the children. So that's a major issue. Though we can't say life threatening, but it's a major issue. We need to handle this iron deficiency anemia, and especially the other major problems like thalassemia and all. If we do not treat them, then it can be life threatening.
What line of treatment is followed in these cases?
Yeah, so I will like divide this into non-cancer patients and cancer patients. Because for mostly if we talk about the major issues like thalassemia or sickle cell, or aplastic anemia, so these are non-cancer problems, but they are major blood related disorders. So for thalassemia, the child will require blood transfusion, because in this condition the blood will break down and hemoglobin will fall, and almost every month the child needs blood transfusion. And once you give repeated blood transfusion, the child will tend to get iron overload. Iron will get deposited inside the liver or the heart, and that will get damaged over a period of time. So then the curative treatment is actually bone marrow transplant. Like this, giving blood transfusion or giving a medicine to reduce the iron load is kind of you're controlling, or you are just giving us a temporary solution to the problem. But if you want a permanent cure, then we have to think of bone marrow transplant, which is a curative treatment option for thalassemias and even for sickle cell anemias. In bone marrow transplant, like it is kind of replacing the bone marrow of the patient with a normal donor stem cells. So you are completely replacing the bone marrow, because it is a genetic issues. It's an inherited problem. No? So we need to find a suitable donor which is normal person, from where you collect the stem cells, give it to the patient, so that it's a big process. We can discuss that later. And coming to cancer, then aplastic anemia and other conditions where also bone marrow transplant is the curative option. There are drugs available, but usually those drugs, they do not work so much in children. They work better in adults with aplastic anemia. The children usually require a bone marrow transplant for aplastic anemia.
You are listening to Rainbows of Hope, a unique series on childcare by Rainbow Children's Hospital in association with Earshot. I just wanted to know, how long is the BMT process?
Yeah, BMT process, it's a long process in terms of the treatment part. Maybe the patient will need to stay inside the BMT unit for almost 4 to 6 weeks, maybe more than that also, sometimes depending on what conditions, what type of donor we are using. But after that also, patient has to be on regular follow-up. At least first 3 months is very crucial, and even after that 6 months to 1 year, we keep them on follow-up, because they are on some medications even during that period. because when we are using some others stem cells, then we have to maintain that cells inside the body, so we need to give some medications.
Right. And what are the likely side effects that we see and how are they managed?
Yeah, see, as I said, bone marrow transplant, where we have to give some other stem cells. We are talking about allogenic now. I'll just clarify here one thing. The bone marrow transplant, there are two types. One is allogenic, one is autologous. Allogenic means like for thalassemia, sickle cell, for aplastic, even for some blood cancers who do not respond to your normal chemotherapy, or they come back after after the full treatment. They come back, the disease comes back. In those relapse leukemias also, bone marrow transplant is used as a treatment option. And that is called allogenic bone marrow transplant, because where you are using a separate donor to replace your stem cells by another donor cells. In autologous bone marrow transplant, we are using the same stem cells from the patient only. And this type of bone marrow transplant is little simple. It is usually the patient just needs to be admitted for just 3 weeks of time, and we don't need too much of follow up like allogenic transplant, because we are using the same stem cells. So this is done specially for cancer patients like neuroblastomas, some relapsed lymphomas, like some brain tumors. Those are solid tumors, not blood-related problems. But if it's a blood-related problem, then it is an allogenic bone marrow transplant. So as I said, we use some donor stem cells, no? So then you have to completely remove the stem cells of the patient. So you have to clear the bone marrow. Now, existing stem cells or whatever cells in the bone marrow has to be cleared. For that, we have to give some chemotherapy medicines to the patient. Though these are non-cancer patients, still we use chemotherapy, because chemotherapy will kill all the cells in the bone marrow. And then only this bone marrow can accept the donor cells. Otherwise, it will not accept the donor cells. So this problem can cause infections, because you are killing all the cells of the patient. So patient will not have the cells for few days, because this stem cells, the new stem cells which you have given to the patient, it takes time, sometimes 10 days to 20 days to come back to the patient's blood. So then during that period, we have to keep the patient in an isolated BMT. Specialized rooms are there which have HEPA filters. We reduce the infection rates. So we have to control the infection is another side effects. Then the patient will need blood products, because his hemoglobin will low. Everything will be low. Cells will be low till the new cells comes up in the body. Then once the new cells comes up in the body, the another problems comes in that, because these are some body cells we are taking. Though we are matching, there is some HLA testing we do. Still, there is an interaction between these two cells. This is called graft versus host disease. So that condition usually causes a lot of problems affecting some of the organs. There are medicines to prevent this side effects, and even after medicine it happens, then also we have a lot of new medicines coming up.
Yeah, I'm guessing that's the reason why one has to be very careful about where the BMT process is done, because there are so many. The process itself is
Is a little complicated, little major process.
Correct.
You are listening to Rainbows of Hope, a unique series on childcare by Rainbow Children's Hospital in association with Earshot.
You did mention about BMT being used in neuroblastoma, and I remember we spoke about a neuroblastoma stage 4 case of a 2-year-old and another one of a little baby at 1 year, 8 months who came to you with severe abdominal pain and I guess was diagnosed with cancer. These are complicated cases, and I'm really hoping to hear from you that you found success in them.
Yes. This usually nowadays for neuroblastoma, if they are advanced stage, then we do bone marrow transplant as an upfront treatment. Like normally for cancer patients, we do bone marrow transplant as a second line if they do not respond to the routine chemotherapy or surgery, whatever treatment we give. But in neuroblastoma, if they're advanced, you have to give chemotherapy first, then you do surgery, then there's a process how you do, and then at the end you do a bone marrow transplant. So the child, 2-year-old, he actually came with a very advanced disease. Disease all everywhere in the body. Every bone of his body is involved. There is a big mass in the abdomen. So neuroblastoma usually arises from the adrenal gland, which is just above our kidney, or it can also develop in the chest also. But in this case, it is in the abdominal mass. and the disease has spread to every bone of the child, even in the scalp, then vertebral bones, and he had a fracture in the humerus, like this is a bone in the hand, upper arm. That bone is fractured because of the disease itself. Then he was not able to eat. There's a big mass inside his mouth. The mandible, our chin bone, was also involved with the disease. So he was in severe pain when he came, and with a very advanced, not able to walk, and always sticking to his mother in pain. And initially, when he started treatment, he required a lot of supportive care, because he had, when you have a lot of disease in the body, once you start the treatment, patient will have a lot of side effects also, because his bone marrow was also involved. The cells, cancer cell, has gone inside the bone and into the bone marrow.
Right.
So then he had a long stay in the hospital, but finally he came out and he completed all treatment. And even after chemotherapy, all his metastatic sites disappeared. We were very lucky, and he was also fortunate to have responded so well to the treatment. And
How
a
wonderful
lot of
to hear that.
yeah, that's
Um,
actually we also feel very great, no? Whenever like
Right.
your these patients, they recover, and then you feel good. And the one thing I will just add here, that these patients, no, this patients, when they come with a lot of disease everywhere and complicated, just giving chemotherapy is not a solution, because you need a lot of supportive treatment, because you need an ICU backup, pediatric
Right.
ICU backup, some other gastroenterologist support, sometimes some pediatric neurologist support. So it's a full super specialty support you need when you treat such kind of patients, and also some trained onco nurses who can handle this difficult patients. So that's very important.
I think that is one of the
While
most
managing these
important
patients, yeah.
things that parents should keep in mind before choosing their hospital as well. Last question, doctor. When we talk about pediatric blood disorders and cancers, what are the red flags that parents should be aware of? Because we are talking about symptoms that can emerge or manifest as young as a year old. And most parents do not think about blood disorders or cancers when they see some symptoms in their children. It's like unheard of. When should they be coming to the doctor and not delaying?
Yes, see, the very common blood problem or common cancer is leukemia, no? So this is one of the most common cancer, and it's the best cancer to be treated. The outcome is almost 80 to 90% are cured if we treat
Wow.
them early. So that's a good thing. And most of the childhood cancers are now curable. So early detection is very important. So the main thing is that if the child is getting some purpuric spots, like rashes, small rashes suddenly, or getting a bruise without any fall, or something spontaneous bruise, or then if there is a fever, as I said, if continuous fever for a long duration of time, and we are not able to find any cause for the fever, that if the child has headache or vomiting which is continuously happening, sometimes we think it is because of our stomach problem, but if it is not getting resolved, then it can be a sign of brain tumor. Then if your child tummy is bloated, you see a small child, a tummy is bloated, you are not able to find any cause for this. So these are some of the signs and symptoms, like of the child can have some blood disorders or cancer. Then if the child has bone pain, continuously some joint pain or bone pain, or if you see any lymph nodes enlarged, which is persistently enlarged. In small children can get small nodes in the neck, but no need to worry about that. But if it is there for a long time and the size is increasing, that is again another symptom for lymphoma.
Got it.
And for thalassemia and all, like which is non-cancerous condition, where the child, you will see that child getting transfusion at a very young age. You can see that suddenly the hemoglobin will be low, child will look pale, your pediatrician will advise you go for a blood transfusion. Then it's a worry if your child is getting blood transfusion below 1 year of age. So we need to look for this signs and symptoms.
Well, that's it for now in our second episode of Rainbows of Hope. I'm sure our listeners have gone back more aware and also much more hopeful after listening to you, Dr. Nandini. Thank you so much for joining us.
Thank you so much.
Parents and near and dear ones of young hearts listening to our podcast, remember, we have got Rainbow One for complex and critical cases. For any such cases in children, visit rainbowhospitals.in or call at 888 22 81 281. 888 22 81 281. We'll be back soon with our third interesting episode. Tune into Earshot on www.earshot.in. You can download the Earshot app from the Google Play Store. Our podcasts are also available on Spotify, Google Podcasts, JioSaavn, Apple Podcasts, and Gaana. Stay happy, healthy, and always hopeful.